Hello, and welcome to this recorded presentation of Staying Healthy and on Your Feet. My name is Jamie Colley, and I'm a physical therapist with Providence Rehabilitation Services and Providence Senior Health Program. This presentation is recorded from one of our in-person educational events, which we regularly offer throughout Oregon. These presentations are provided free of charge to all community members in collaboration with various community hosts, such as senior centers, independent living communities, churches, and other organizations that support older adults. Providence offers about 10 to 12 of these educational events throughout Oregon each year. This presentation aims to help older adults better understand and manage their personal fall risk factors, empowering them to stay active, independent, and safe. If you're interested in attending a future in-person event, please visit providence.org/OR Falls classes to view upcoming events near you. This address is listed at the bottom right of your screen, and you can scan the QR code listed there. The recording that you are about to watch was originally delivered in May of 2025 to residents of the Springs Living Clackamas Woods. It was led by physical therapist Lizzie Higgins and Providence Pharmacy resident Judy Wong. To support your learning with this video, we've included several helpful resources that are linked below. First, a self-assessment questionnaire to help you evaluate your personal fall risk. Secondly, there's a home safety checklist for you to use in your own home. Third, there's a list of high-risk medications that are often associated with falls. And lastly, there's a link to a survey where you can share your comments and feedback with us to continue to improve this experience for the future. Thank you for listening. I hope you enjoy this presentation.
Goals for today are to help you understand what contributes to a risk for falling, and then also underline things that you can do to help reduce your risk for falling. And then on top of that, we want you to know that falls are not an inevitable part of aging, and there's a lot that you can do to reduce your risk. Okay, so let's start with some background on falling. A fall is any unexpected change in your position. It doesn't necessarily mean that you land on the floor. So if you lose your balance and you fall into the wall, or you fall onto your couch or onto your bed, those are all still considered fall. And this form we looked at, we'll go through the different items as we move forward. What I like about this form is it underlines a lot of different factors that contribute to your risk for falling, and especially some things that we wouldn't necessarily think about. And I really want to point out that a score of 4 or more is considered at high risk for falling. A score of 3 or less is considered low risk for falling, but not no risk for falling. None of us are at no risk for falling. So if you do get a score of 4 or more on this, it's a great opportunity to talk to your healthcare provider about what you can do about it. So here we underlined some big risk factors for falling, and you'll notice we divvy them up into things that you can change and things that you can't change. So if you look under things you can change, we have gait, strength, and balance issues. We also have hearing and vision problems, behavior and choices, such as staying active or not staying active, alcohol use. Also risky behaviors like climbing on ladders or standing on a chair to reach for something up high instead of asking for help. We also have medications, which Judy will talk more about, footwear, need for walking aids like walkers or canes, home safety, needing caregiver help, which actually is associated with an increased risk for falling. And there's a lot that you can do with your primary care provider and rehabilitation to stay independent with things like going to the bathroom, bathing, dressing, cooking, cleaning, to keep you independent and to reduce your risk for falling. And then also depression and anxiety, which we'll talk more about later. Under the things you cannot change, you see age and age-related changes. There's also chronic health conditions, severe illnesses and acute hospitalizations, and memory and learning issues. But I do want to point out with memory and learning issues and chronic health conditions, just because we can't take them off the plate entirely, there's a lot that we can do to manage them well. So for instance, with chronic health conditions, working with your primary care provider and pharmacist to, for say, manage blood pressure well, so that it's not making such a big impact on your risk for falling. And then memory and learning issues. You can work with speech and occupational therapy to gain tools to know, for instance, remembering to wear the proper footwear, or remembering to bring your cane with you when you leave your house, or knowing to engage in safe behaviors. So women do report more falls than men, but men are more likely to die from a fall. We believe that's related to men typically fall when engaging in higher risk activities. And the longer we live, the more likely we are to experience a fall. And that's because of natural changes in our bone density and muscle strength, as well as our chronic health conditions. One out of 4 adults over the age of 65 fall every year, but only half of those people report falls. And we believe that's related to fear of their independence being taken away from them, feeling like they can't do anything about the falls, and also just not wanting to talk about it. But actually talking to your healthcare provider about it, they can give you resources to stay independent. So it's actually quite the opposite. Having those conversations can help you stay independent for longer. And on top of that, there is a lot that we can do to reduce your risk for falling, which hopefully this presentation today will help underline that. 1 out of 5 falls leads to a serious injury, and falls are actually the leading cause of hip fracture and brain injury, with more than 95% of hip fractures being related to a fall. Women are 3 times more likely to experience a hip fracture than men, and that's related to changes that happen to our muscle strength and our bone density, secondary to hormonal changes that happen during menopause. So diet and exercise become especially important surrounding menopause to keep our bones and muscles strong. So now we're going to talk about things that you can do to address these risk factors. So in this image, it demonstrates the different people who have control over addressing your risk for falling. And notice that at the center of the picture are you, your friends, and your family. So you have the greatest control to reduce your risk for falling. In the second circle here, we have primary care and pharmacy, because they can help you manage those chronic health conditions and stay ahead of these issues. In the outer circle here, we have other healthcare providers like optometry, podiatry, and rehabilitation. So when we talk about rehabilitation, we're talking about physical therapists, occupational therapists, and speech therapists. And rehab can happen in an outpatient setting, or they can come to your home. So, and I know at the Springs you have rehab on site, which is awesome. I think there are some limitations there, which we'll talk about later in resources for that. But let's talk about your home more. So having an occupational therapist do a home safety assessment can reduce your risk for falls by 1/3. And it doesn't just have to be an occupational therapist, it can be a physical therapist also. And if you are unable to get a professional home safety assessment done, we did include in your packet a home safety checklist. And I like it because it demonstrates, or it goes room by room, so it's really easy to follow along. And I also like it because if there is a safety issue, it makes recommendations about what you can do to address that. Having adequate lighting in your home is vital to staying safe in your home, especially between your bedroom and the bathroom. Because a really common time when people fall is getting up in the middle of the night to go to the bathroom. So night lights are a great option for that, and you actually have a night light included in your mobility kit that we passed out today. If you don't like the light being on at all time, there are options that are motion sensor or options that come on at night and go off when the light comes up in the morning. And then if you don't have outlets available, there are also LED options that don't need outlets. I've also had people put like Christmas lights under their bed frame, which is cute and also keeps your bed well lit. I understand that at the Springs, your home is already really well equipped with grab bars in your bathroom, which is wonderful. On top of that, if you are having a hard time getting out of bed or getting out of your chair or your couch, you can request installation of a transfer pole. So this here, if you can see that okay, that's a transfer pole. So it's something you can hold on to help with those transitions. If you do happen to lose your balance, make sure that if you do have to reach for something, you're reaching for something that's intended to bear your weight. Like a grab bar, it's there to bear your weight. A towel bar is not. So don't reach for the towel bar because it's just going to come with you. It's not going to do you any good. Okay, and always making sure that you keep your pathways clear of shoes, cords, pet toys, grandkids' toys. If you happen to spill something on the floor, make sure you clean it up right away because it can be really hard to see those spills. And then we always recommend people remove throw rugs, and because they're just a tremendous trip hazard. And if you aren't able to remove the throw rug, make sure that you're using double-sided tape or a non-slip backing so that it doesn't pile up and create an even worse trip hazard. Pets are a wonderful part of life, but they do account for about 1/3 of the falls in the home, with 9 out of 10 of those being dogs and only 1 out of 10 being cats. And they've actually found that they're more related to pets getting underfoot than actually jumping on you, which I found surprising. So again, making sure that pet toys aren't laying on the floor and creating a hazard there. And then making sure that your pet is trained well to be able to stay where you need them to be and not getting underfoot. Oh, and then also if someone is recovering from illness or surgery, keeping the pet away from them for that temporary period because we are at greater risk for falling when we're recovering because we are weaker during that time. And so while I'm sure having a pet there would feel really good, it does increase your risk for falling on top of an already higher risk for falling. So keeping them separated during that period can help reduce that risk. And then making a safety plan. Like I said, none of us are at zero risk for falling. So having a plan in place in the case that you do fall can really help reduce the adverse effects of that fall. So keeping a phone on you and keeping it well charged is a great option. You can consider a medical alert device as well. So they have a lot of different versions of this. They have some that only work in your home. They have some that work in your home and outside your home. Some that have GPS on them. They even have some that have fall detection programs. So like an Apple Watch, for instance, if you fall, it detects that fall, and then it can alert emergency services or your emergency contacts for you. Also, the great thing about medical alert devices, most insurances cover them to a certain extent. So if you don't have a medical alert device and you're interested in getting one, I would call your insurance and see what they cover, because it's very likely that you could get one with no cost to you. Also, it's great to work with a physical therapist to make sure that if you do fall, you're able to get up from the floor so that you're not stranded on the floor for an extended period, because a lot of injuries happen from being on the floor for a long time. You can also keep emergency numbers handy and in large print so that they're easy to read. And then having people check on you regularly or call you at certain times just to make sure that you're okay. Okay, so we've talked about the home. So now let's talk about behavioral health. So depression does increase your risk for falling by 1.5. And that's because with depression, we tend to have poor sleep, which makes us fatigued and weaker throughout the day. Poor appetite can impact our nutrition. So like we were talking about before with the hormonal changes that happen during menopause, diet becomes really important to make sure our bones and our muscles stay really strong. And then on top of that, some of the medications that we use to treat depression increase our risk for falling. And with depression and anxiety, we notice slower movement, thinking, and decreased attention as well. And then fear of falling and anxiety can increase your fear of falling. It's kind of an unfair relationship in my mind, but it can lead to the cycle of falling. So this is what we consider the cycle of falling. And I'd like to start here with reduced ability to easily move about, because that's something we experience as we get older naturally. And so as we're not able to move as easily, we stop engaging in activities and we become a bit more isolated. And then with that, it furthers our decrease in physical fitness and can contribute to further depression as well, which then can increase our anxiety and fear of falling, which then can reduce our activity participation. And then it all starts over again. So the question becomes, how do we break that cycle? One major way we do that is through education. So kudos to you all for being here today. Great first step. And then on top of that, talking to your healthcare providers, your primary care providers, your physical therapists, and then working on your physical fitness on top of that. So let's first look at your muscles. Having adequate strength is vital to being able to take adequate movements to prevent falls. By that, I mean you need good muscle strength to take a good sized step when you're walking, to pick your feet up high enough that your foot doesn't catch the floor. If you do lose your balance, being able to take a big step to catch your balance. On top of that, our feet, eyes, and ears all give feedback to our brain about where our body is in space. And then our brain relays that to our muscles so that they can respond appropriately. And so our brain is controlling all of this. It's coordinating all of this information. So a normal change with aging is that our brain has a harder time with switching attention and multitasking. So it makes sense that people tend to have more falls as we get older while multitasking or while distracted. With your eyes, make sure that you're getting your vision checked regularly. Keep your glasses clean. So also in your mobility kit, we have the lens cleaner cloth, the lens cloth to keep your glasses clean. Wear sunglasses to reduce glare. Pause when coming in from outside to let your eyes adjust so that you can see the ground and any obstacles clearly. Look a few steps ahead of you to see any obstacles, and work with your doctor to treat cataracts as soon as possible. And then multifocal lenses, otherwise known as progressive lenses or bifocals or trifocals, actually do increase our risk for falling because the low part of those lenses are intended for up close reading. And so as you see in this picture, hopefully you can all see this clearly, the low part that's intended for reading skews how the curb looks. So it creates a little bump here, and here it actually shifts where the curb actually is, or the stair. And so it can make going down stairs, curbs, or other areas where there's contrast in the surface, it can skew our perception and lead to missteps, and then losing balance, and then a fall. And so we always recommend that people have a pair of single focus lenses that they can use when walking outside or doing stairs. And then if it's helpful, Costco and Goggles for You are online resources where they offer inexpensive pairs of lenses if you have a prescription for that. Your ears give you an internal sense of where you are in space. So if you've ever heard somebody refer to your inner ear in regard to balance, that's what they're talking about. And so vertigo is an issue with your inner ear, and that's where you feel this spinning and losing balance. And it's actually pretty treatable. It typically has a really quick fix. And this is something that people often think is just a normal part of aging. It's not. It becomes more common as we age, but it's not normal, and it has a pretty easy fix. So I really encourage you to talk to your doctors about that if you are experiencing that. Hearing can also affect our balance because that's one of the ways that we orient ourselves to our surroundings. So for instance, if you have a hard time hearing and you may not hear someone walking up behind you, you may take a step in front of them and then they can bump into you and cause a fall. So talking to your doctor about making sure that your hearing is being addressed is a great way to make sure you are orienting to your surroundings well. Footwear is really important for reducing your risk for falling. As you see, older adults who walk barefoot in socks or in flip-flops fall more. So good, adequate shoe wear involves good traction and having a back on it. The back is really important so that it doesn't slip off your feet. And then, so always avoiding shoes with like smooth leather bottoms, especially slippers. Slippers tend to lack traction, but they have a lot of good options for comfortable slippers with backs and with good traction. If you have pain in your feet or any sensation impairment in feet, it's important for you to talk to your doctor or a podiatrist about that. Because as we have pain in our feet, then we tend to not be as active because it hurts. So why would we be as active? And then we go back to that cycle of falling we were talking about. As you're less active, you become more isolated, and then that contributes to decreased physical fitness and increased fear of falling, and so on. On top of that, sensation issues, like we talked about before, feet are one of the ways that our brain gets feedback about where we are in space. So if we have reduced sensation in our feet, we're not getting great feedback. And so talking to your doctor or a podiatrist about that as early as possible can help nip that in the bud. Some benefits of exercising: it reduces symptoms of depression and anxiety, it improves muscle strength, maintains and builds bone strength, reduces your risk of falling, and lowers your risk of injury with a fall. Because as we exercise and our bones and our muscles are stronger, if we do fall, you're less likely to have a fracture from that. So a complete exercise program involves 3 parts: endurance, strength, and balance. Now, any one of these parts is better than no exercise, but all 3 parts combined is going to be the most effective way to reduce your risk for falling. So speaking of endurance activity, that involves sustained movement that gets your heart rate up. So going for a nice leisurely walk is movement, and that's great, but if you can, doing it in a way that challenges you enough that your heart rate increases is going to have the best impact on your physical fitness. Examples: walking, gardening, dancing, swimming, and Tai Chi. We're going to talk a lot about Tai Chi. And then I think you're going to have an opportunity to try some Tai Chi today. And then the goal for endurance or aerobic activity is 150 minutes a week, which divvies up to about 30 minutes 5 days a week. But you can spread it out however works for you and your schedule. Strengthening: it's important that when you're doing strengthening, you're challenging your muscles beyond what they're used to doing. So same example, if you're walking, that's great activity, but it's not getting adequate challenge to your muscles. So that's why doing strength training at least twice a week with a repetitive basis, so we talk about 8 to 12 repetitions, is necessary to make sure that your muscles are getting adequate challenge so that they can actually strengthen. So some nice ways to incorporate this: push-ups, squats, heel raises. Now, and you can do that at a counter. So heel raises being like this, and squats, if you want to hold on to something or do push-ups on your counter, those are all safe ways that you can incorporate that at home. If you don't know where to start with strength training, because I know it can be daunting, talk to your physical therapist if you have one, or talk to your primary care provider about resources for that. Again, a lot of insurance programs have like gym memberships as part of their benefits, where you can go to a gym at no cost to you, and often they include personal training there. So a good option for that. And balance exercising. That tends to be something that goes to the wayside the earliest, understandably, because if we're worried about falling, we don't want to do things that challenge our balance. But that is the best way to keep us well balanced. And again, talking to a physical therapist about this, they can guide you in how you can challenge your balance in a safe way at home, how to set up your environment to do these exercises so you can still challenge your balance, but be safe in the meantime. Tai Chi, they found that if you do Tai Chi twice a week for 24 weeks, or 6 months. They found improvements in balance, strength, and flexibility, as well as your aerobic capacity, meaning your ability of your heart and lungs to deliver oxygen to your muscles. On top of that, it reduces your risk for falling, and it reduces symptoms of anxiety, depression, arthritis, Parkinson's, and other conditions as well. And then, like we've talked about, physical therapists are a great resource for building an exercise program to address those 3 factors that we were talking about: strength, endurance, and balance. Doing a home safety evaluation, any equipment needs, meaning equipment for in your home like a transfer pole, or any walking devices like canes, walkers, and making sure that they're the right size for you. And then this is kind of what I was talking about. It sounds like at the Springs you don't have vestibular physical therapists or pelvic floor physical therapists. But like we were saying, dizziness is more common as we age, but it's not a normal part of aging. So if you're experiencing that, talk to your doctor about if seeing a vestibular physical therapist is a good option for you to address that. Also, incontinence, more common as we age, but not a normal part of aging. And working with pelvic health physical therapy can reduce that. And that makes a big impact on reduced risk for falling, because like we talked about, getting up to go to the bathroom in the middle of the night or hurrying to the bathroom are really common times that we see falls happening. And then cognitive therapy, so working with occupational or speech therapy to address your memory, learning, attention issues. They can help make sure that you're engaging in safe practices and having tools to remind you to do things safely as well.
Thank you. All right, so we're gonna get a little bit deeper into the medication portion of this. And again, if you have any questions, just be sure to raise your hand. That's perfectly fine in the moment if you need to. But a little bit of an overview, always talk to your primary care provider about falls, and then also ask about your medications as well. There's a lot of medications that we all take over the counters or prescribed that can increase your fall risk. So it's always a good idea to keep track of your falls, even if they're a near miss fall where you don't think it necessarily counts as a fall. It's always good to keep track of that, make note of it, and let your primary care provider know, because it can lead to more conversations and maybe even a referral to CPT or OT. And then also making sure you're keeping an updated medication list, and you're reviewing that with your primary care provider at least once a year. And then just like to note that when you have 4+ medications, it increases your risks of falls, especially if the medications on that list already have an increased risk of falls by themselves. It can be an additive effect. So moving on to what is considered a high-risk medication for falls. Any medication that slows down your reaction time, causes confusion, causes dizziness, or even lowers your blood pressure can increase your risk for falls. So some of these medications include OTC or over-the-counter products, any products that contain the word PM, so like Tylenol PM we would want to avoid, but Tylenol is perfectly okay. Any nausea medications or any pain medications, so what we're looking at are really going to be our opioids, so like oxycodone or morphine. So like I mentioned before, Tylenol is great. Extra strength Tylenol is fantastic to use. If you are experiencing any pain, you can use up to 3 grams or 3,000 milligrams a day, but making sure that it's all sources. So if you're on medications like Norco that have Tylenol in them, just making sure you don't go over that 3 grams, including any other additional Tylenol that you're taking. Any anxiety or antidepressant medications such as Xanax or Valium, any muscle relaxants that you might be on, and then any bladder control medications, just because some of these medications can either dry you out or cause you to use the bathroom more, it can increase your fall risk. And of course, any sleeping aids, so such as Ambien or Lunesta, of course, because they help you sleep, they relax your body, they can cause a little bit of drowsiness as well. So if you get up in the middle of the night, it can increase your risk of falling if you're drowsy. And then, of course, alcohol. And then an important question to ask, especially having that open dialogue with your providers, is do I still need this medication? And then can this amount be lowered? So we're not necessarily saying no to any of these medications, but we want to try and find that lowest effective dose, just to make sure that we're minimizing any of those side effects that we don't want you to experience, but you're still getting the benefit from that medication. And then, like I said, we're going to go a little bit deeper into sleep aids, because I know as we age, it can be a little bit harder to fall asleep, to stay asleep as well. So a lot of the times providers will prescribe you medications for sleep. But like I mentioned, a lot of these medications, because they help with sleep, can also induce a lot of drowsiness, especially when you wake up in the morning. So other things that we can try before leaning on these prescription medications is to try and change your sleeping habits. So I'm sure a lot of you have already heard about good sleep hygiene, but if you haven't, good sleep hygiene is ideally avoiding any screen time before bed, avoiding any alcoholic drinks right before bed, avoiding any intense or moderate intense exercise right before bed, kind of leaving your bedroom or your bed area just for sleep, so no TVs in that room, just so that when you enter your bedroom and you're in bed, your brain knows that it's time for bed, and so it can kind of start into that cycle to get you ready for sleep. And then another medication that we like to point out, melatonin, is a safe sleep medication. Definitely something that you would want to let your provider know if it's something you're looking to start. There's a lot of different doses that are available for over-the-counter melatonin. We ideally recommend either the 1 milligram or the 3 milligram doses for use. And then if you notice that that isn't helpful, then that's definitely another reason to let your provider know, because it might be time for you to see a specialist that can help you with sleep. And then something to also note, melatonin should ideally be taken at least one hour or 30 minutes before bedtime, and then avoid any screen time or excessive light or sunlight, because that can disrupt how well the melatonin works. And like I mentioned, bladder medications can also increase your risk for falls. But as we age, we can have issues with urinating. Either we're feeling like we're not urinating fully, or you're leaking a little bit. So other things that we can also try that may lower that dose of bladder medication that you're on, or actually maybe help you get off bladder medication, because like I mentioned, having 4+ medications already puts you at an increased risk for falls. So other things that we can try on top of bladder medications is elevating your legs 1 hour before bedtime, urinating before going to bed, avoiding any caffeine after noon, limiting your alcohol intake, eating smaller meals, limiting any high acidic fruits, veggies, or spicy foods, limiting fluids after dinner, except for when you need to take medication, and then removing any tripping hazards on the way to the bathroom. So like you heard earlier, making sure that you have a clear path to the bathroom, especially when you have to wake up in the middle of the night and it may be a little bit darker, or you may feel a little bit drowsy from waking up, that you don't have any obstacles in your way that can increase your risk of falling. And then, as previously mentioned as well, considering any pelvic floor exercises or therapy in order to help strengthen those muscles in that area. So best practices for high-risk medications is to stop any unnecessary medications if possible. So every time discussing with your provider, are these medications needed? If so, what alternatives can I use before trying this, or what is the lowest dose that I can possibly start at in order to make sure that I'm taking this medication safely. And then alcohol also increases your fall risk as well. It decreases your coordination, your mobility, your balance, and your reaction time. It can also worsen your blood pressure, memory issues, mood, diabetes, digestive issues, osteoporosis, and liver damage. And it can also actually interact with a lot of the prescribed medications that you might be taking. So the recommended limit is 2 drinks daily for men and 1 drink daily for women. And it's also important to note that if you're outside getting a drink, sometimes they don't really follow what the recommended serving size for alcohol is. Ideally, it's 5 ounces of a 12% alcoholic level or alcohol by volume drink, or 12 ounces of a 5% or 1.5 ounces of a 40%. So a lot of the times if you're getting a drink outside or at a restaurant, they can serve a lot of these drinks in 16 or 20 ounces. So just keep that in mind if you are ever drinking like outside or someone else is serving you a drink. So blood pressure changes can also increase your risk of falling. The one we're most concerned about is low blood pressure changes, especially if you're going from sitting or laying down to standing. Sometimes your blood pressure can drop and that can cause you to feel dizzy or unstable. So as we age, your blood pressure can change, but the most important thing we're worried about is going to be that drop in your blood pressure. And so bigger change with the more medications you take as well. So this is always good to discuss with your provider if you can maybe pull back or decrease some of those blood pressure medications. Also discussing blood pressure goals. I know there's a couple different goals out there, but for all of you, we really would aim for anything less than 140/90 for your blood pressure because we're more worried about those low blood pressure effects, as well as making sure that when you're changing positions, try to do it slowly, not making any fast movements because that can also drop your blood pressure. Ensuring that you're drinking enough fluids or water, but again, limiting after dinner or after 5 p.m. Because we don't want you to drink too much water right before bed because that can increase the amount of times you have to wake up in the middle of the night to use the bathroom. Diet and exercise, as well as stress reduction, and then drinking less alcohol can also improve your blood pressure. So then a little bit more about osteoporosis. So osteoporosis is when your bone density gets less over time. So this happens to everyone as we age. So the picture can show you it becomes more porous or more holes in your bones, which decreases your bone density. This occurs more in women than it does in men, just because after menopause, with all of our hormonal changes, it can decrease how we build our bones. So actually half of women over the age of 50 will have a fracture due to osteoporosis. And this is really hard to tell because usually there's no symptoms that you'll see from osteoporosis until you have a fracture of some sort. So ideally we're gonna be able to get bone scans, so bone density scans or a DEXA scan in order to see what your bone density looks like. And other things that we can do in the meantime in order to support our bone growth or bone production is to ensure that we're having adequate vitamin D and calcium supplementation. So the recommendation is actually to get calcium from our diet. And so a lot of the times we can get that from milk, from yogurt. If you're not able to have any dairy products, there's a lot of plant-based milks that have added calcium. So those are all great options. And then vitamin D, especially in the Pacific Northwest area, we tend to have a vitamin D deficiency, but it's actually very important to have adequate vitamin D in order to have that calcium work well and actually build our bones. So if we have a vitamin D deficiency, that calcium is not going to work as well in our bodies to build the bones. And then, like I mentioned, so vitamin D and calcium. Vitamin D, the recommendation for daily dose is 4,000 units daily from all sources with a minimum of 1,000 to 2,000 units. So usually when we're looking at supplements for vitamin D, we recommend between 1,000 to 2,000 units. Whatever works best for you. If it's 1,000 units is one capsule, then we would recommend you take that instead of taking 2 capsules. And like I mentioned, it helps the body absorb calcium a little bit better. And then for calcium, it helps strengthen your bones and then helps prevent any fractures. And ideally, you're aiming for about 1,200 milligrams daily from all sources, mostly from food. So we try to encourage getting your calcium from your food intake. But if needed, you can take any supplements in divided amounts. So Tums is a great option if you're looking to increase your calcium intake, but the body can only take up to about 500 milligrams of calcium per sitting. So ideally, we want to split up that calcium or the Tums that you're taking. So you can take it with every meal, so 1 to 2 of those tablets every meal as a good way to remember to have that calcium intake with your food.
Thank you so much for listening. I hope you found this content useful. I'd encourage you now to take a moment to reflect on your personal fall risk, thinking about what personal plan for managing fall risk based on the risk factors you learned today. Which risk factors apply most to you? Which changes feel easiest to start with, and which might take more time and effort? To help you take action, consider writing down 3 specific changes you're committed to making based on this presentation. Then I'd encourage you to share those behavior changes with somebody in your life who can help keep you accountable. Taking even small steps can help make a big difference in staying healthy and on your feet. As a reminder, check out the resources linked below, including a survey where you can share your comments and feedback with us to continue to improve this experience for the future. We've placed the QR code for the survey on your screen to the right. If you have any additional questions, comments, or would like to inquire about hosting a class, please reach out to us at ORSeniorHealthProgram@providence.org.